He feels healthy. He exercises occasionally. He has no pain, no dizziness, and no obvious warning sign. But inside his arteries, something may already be happening silently. High cholesterol usually does not cause symptoms, yet over time, abnormal cholesterol levels can contribute to plaque buildup inside your arteries and increase the risk of heart attack and stroke. Hello everyone and welcome back to MedInsight Academy, where we simplify medicine and empower you with knowledge that can protect your health. We have previously explored what hypertension and diabetes is, and today we will focus our attention in another cardiovascular risk factor called cholesterol. In this three-part series, we will explain what cholesterol is, what the numbers of cholesterol mean, how high cholesterol damages your arteries, and what you can do to lower your risk. So what exactly is cholesterol? Cholesterol is a waxy fat-like substance that your body needs. It helps build cell membranes and is also used to make certain hormones and bile acids. Your body produces cholesterol mainly in the liver, and you also obtain some cholesterol through animal-based foods. The important thing to understand is that cholesterol on itself is not bad. Your body needs it. The problem arises when certain cholesterol, especially the low-density lipoprotein cholesterol or the LDL cholesterol, becomes too high, and especially when it is in combination with some certain risk factors already existing in your body. And that is where the term low density lipoprotein cholesterol and high density lipoprotein cholesterol become important. Low density lipoprotein or LDL is commonly called the bad cholesterol because elevated LDL cholesterol can contribute to plaque buildup in the arteries, whereas high-density lipoprotein or HDL is often called the good cholesterol because it helps transport cholesterol away from tissues towards the liver for processing. But cholesterol is more complicated than simply good versus bad. Your overall cardiovascular risk depends on your complete lipid profile and other risk factors. So when you receive your cholesterol test, don't focus on just one number. Your LDL, HDL, triglycerides, total cholesterol, and your overall health condition all matter when assessing cardiovascular risk. Another important number on your lipid profile is triglycerides. Triglycerides are another type of fat in the blood. Your body stores excess energy as triglycerides. High triglyceride levels can occur alongside obesity, diabetes, metabolic syndrome, certain dietary patterns, alcohol use, and some medical conditions or medications. This is why lipid profile gives you more useful information than simply asking, is my cholesterol high? And the numbers need to be interpreted in the context of the individual. High cholesterol can have many causes. Genetics can play a major role. Diet, physical inactivity, excess body weight, diabetes, and certain medical conditions can also affect cholesterol levels. Some medications can influence cholesterol as well. And in some people, extremely high cholesterol can be caused by an inherited condition called familial hypercholesterolemia. This is particularly important if several members of a family have high cholesterol or develop heart disease at a young age. In such situations, a medical evaluation for an inherited cholesterol disorder may be necessary. Here is what makes high cholesterol particularly dangerous, because you may completely feel normal. Unlike some conditions that produce obvious symptoms, high cholesterol usually does not tell you when it is rising. The first sign of advanced atherosclerosis may sometimes be a serious event such as a heart attack or stroke. That is why screening and appropriate cardiovascular risk assessments are important. You don't need to wait until you have symptoms before checking your cholesterol. But what happens when cholesterol remains high for years? How does plaque usually form? And how can it eventually cause a heart attack or stroke? That is exactly what we are going to explore in the next episode of this series. If you have not subscribed to this channel, please subscribe to MedInsight Academy. Like this video, comment cholesterol on the comment section, and share this video to your friends and family who may need it. You may simply be saving lives. See you in the next episode.